As I sit to record the second in what I hope will be a series of room-bound ruminations, I'm feeling better than I have for a number of weeks. And a lot of that has to do with the tremendous leadership shown by our state government here in Western Australia. For the second day in a row, we have recorded no new cases of the coronavirus. The total number of active cases is nearing 100. And it seems for the first time that a decision to not just lock down our borders with the rest of the country and internationally, but restrict travel and other activities within the state is paying real dividends. And with that comes a sense of ease, particularly for me and my family and those of us in our team at the Perth US Asia Center. At the same time, however, I find my heart is very much with my homeland. Now, those of you who know me for the years I spent working in Washington, D.C. might think I'm thinking about what is going on in Washington, D.C. and the politics around the coronavirus pandemic there. Or those of you who know me a little bit better might know that I might be thinking about the state where I was born, New Mexico, or the state where I was raised, Arizona. But in reality, today, my heart very much is with a land called Deneta, the land of the Dene, the land of the Navajo people. I was raised on the Navajo Nation in northeastern Arizona, northwestern New Mexico, with bits of Colorado and Utah put in together as well. My father taught primary school on the reservation for 35 years, and so I had an amazing and slightly atypical childhood experience growing up in the middle of the Navajo Nation in the capital town of Window Rock, Arizona. If you've followed the news lately, you may have been aware that the coronavirus has had a particularly negative impact on the Navajo Nation, on Deneta, and among the people of my homeland where I grew up. And that has been as heart-wrenching as is our current situation here in Western Australia has been relieving. As of yesterday, there were 1,321 cases of the coronavirus on the Navajo Nation, and there have been 45 deaths. Now, to put that in context, the Navajo Nation is large. It is larger geographically than 10 U.S. states. It's about 71.5 thousand kilometers. That still puts it in Western Australian terms as relatively small, about 26 times smaller than Western Australia. But it has a population of 350,000 people, meaning that it is about 7.4 times smaller than our population here in Western Australia of 2.6 million people, but the largest and most populous indigenous geography or division or location in the United States. And as such, the particularly pernicious impact of the coronavirus in that land is something that is really worth paying attention to, particularly since given the broad geographic spread, but the unpreparedness of the system, the healthcare system, the transportation system, the overall medical system to respond to this disease, it gives us real concern about what might be taking place in other countries around the world. As of today, the death rate per 100,000 in my homeland is about 49 times greater than it is here in Western Australia. And that just highlights the difference in the medical system, in the preparedness and the government policy response, both federally in the United States as well as on the reservation itself. I have given some thought about this. When the West Australian state government made the decision to shut down travel within the state, but between regions in the state, my initial reaction was extraordinarily selfish. I have come to love the beaches up north in Wedge. I've come to love the deep bush and the chance to go camping during spring holidays. And once our travel plans for the spring were shut down, my hopes were that we would travel internally in this state. And initially, I had to confess that I groused a little bit that we couldn't go camping and we couldn't go up to the beaches. But the state government made the case that the shutdown of travel between regions within our state was necessary, not just for the regions themselves, but in particular for the extremely vulnerable indigenous communities and other rural communities that didn't have the healthcare systems to be able to respond to the coronavirus. And the wisdom of that approach, I think, is borne out by the experience of my homeland. I was looking a little bit deeper at it. I think most people are familiar with the phrase or some variation of it, that the measure of a civilization as is how it treats its weakest members. Most people attribute that quote to Mahatma Gandhi, although quotation sleuths and professionals have found that although that certainly mirrors his sentiment, often expressed in many other terms, he's in no case has known to have said those words out loud or put them on paper. In fact, the closest quotations come actually from interesting but equally relevant sources. Many of you will be aware of the American novelist and writer Pearl S. Buck, who won the Nobel Prize in 1932 for her novel about China, The Good Earth. She was the daughter of missionaries living in China, spent much of her life living in China, and as such, her observations, I think, were particularly relevant. Her version of that quotation was, "Our society must make it right and possible for old people not to fear the young or be deserted by them, for the test of a civilization is the way that it cares for its helpless members." Now, seemingly we've got to go back to the past to find inspiration in some of the prose, at least from our political leaders. But another one that I thought was particularly interesting was a similar quotation from Hubert Humphrey. Hubert Humphrey is not well known to history, but he was the vice president to Lyndon Johnson. So during the Civil Rights Act passage, during the Johnson's Great Society, fight, war on poverty, etc. And three-time senator from Minnesota, fierce opponent of the U.S. involvement in war in Vietnam. And he said something that I think actually speaks to policymakers, and from which our government here in Western Australia and others like New Zealand, et cetera, that have handled this well, should take some solace. He said, "The moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped." As I today extend my sincere thoughts, prayers, and best wishes to my friends and family still in Dineta, in the land of the Dene, the land of the Navajo people, the Navajo Nation, I am grateful for the foresight of political leaders here in Western Australia and elsewhere around the world who have made difficult decisions that are made in the interests of the poor and the needy, the weakest in our societies. That is my rumination for this week, and obviously there will be more to come. Thank you.